Great. Welcome, everybody. I'm going to just give it one more minute while folks are coming into the room. All right, so I'd like to start this week's lunchtime learning session by extending my gratitude to the speakers from last week who grounded us in the context of TANF, Reach Up, and welfare reform attempts within the US. The intersections they illuminated between racial justice, economic justice, and reproductive justice is a space where I believe we can do our best work. In Vermont, we have a new engagement model which allows state employees to move away from surveillance and sanctions and engage families with respect for their expertise and skills. Vermont should be proud of these shifts. But Reach Up is a safety net program, which means that at its core, it is a cash assistance program. Today, we will attempt to answer important questions. How well are we doing as a state when we budget for Reach Up? In this year of a surplus budget, have we met our basic obligations to families? If we know that many Reach Up participants could teach a class on budgeting, they know that each monthly obligation to the penny, they are constantly being asked to prioritize and to reprioritize their payments to ensure that their lights remain on, their space remains warm, and their kids have food. Is the state also prioritizing the basic needs of children, youth, and families? I deeply appreciate the featured speakers who are here with us today and look forward to learning from their expertise. Today is Homelessness Awareness Day at the State House, and Paul Dragon will share the housing landscape in Vermont and how it intersects with Reach Up. Dr. Julie Lowell will illuminate the need for a new funding matrix for our grant structure, and we will learn about what our current policy choices mean for children, youth, and families from Donna Bailey and Nate Hine, who work with participants of the program every day. Thank you for being here. As I said last week, it will take all of us, advocates, legislators, state employees, and impacted families to engage in these difficult, unpredictable, and nuanced conversations in order to get this essential public benefit right. I look forward to seeing a safety net that is effective, adequately funded, and celebrated throughout Vermont. Paul, if you want to begin, I know you're on a tight timeline.
Yeah, thanks so much, Amy. Hi, everybody. Great to see so many familiar people, so many familiar names. So yes, and I appreciated the introduction, and it is Homeless Awareness Day. So to that end, I am super interested in Reach Up across the whole spectrum, increasing the rateable, thinking more deeply about expanding the earned income tax credit, certainly looking at any of the requirements around Reach Up so it is accessible to all families who are eligible for Reach Up. Those are very, very important things for me, for many of you. Today, I just want to focus on homelessness because I think we have a very real opportunity to solve child homelessness in Vermont. And I think solving child homelessness can be a strategic first step to solving all homelessness, which is everyone's goal. But the point here is that solving childhood homelessness is very, very possible, and it could be a very strategic first step to ending all homelessness. Just a little bit of context. If you go back to 2016, we had a point in time count where we across the state saw a 28% reduction in the number of homeless individuals statewide. That was the largest one-year decrease in the point in time count in the nation, and Vermont was lauded for that decrease. We had 156 households with children, and then you kind of fast forward to 2022, you have a point in time count with households with children under 18. It increased by 130% from pre-pandemic levels. And we know some of the reasons for that because of the pandemic. It went from 629 families to 857 in 2022. Today, according to the Department for Children and Families, and I think it was just updated at testimony yesterday, but this is from late December where I got it. We have and it's hard to count. It really is. It's such a fluid number, and I understand that. We have approximately 450 families with over 550 children experiencing homelessness in Vermont. So that's a big number, and it's a number that we can certainly get housed. So we all know the risks due to child homelessness in Vermont, and the reason why I'm talking about child homelessness to a Reach Up work group is because we know that Reach Up families are some of the lowest income Head Start families, families who are eligible for WIC. Homelessness is going to disproportionately impact Reach Up families. We know that. And we know that homelessness and some of the risks, we know that children who are homeless have higher levels of emotional and behavioral problems, increased risks of serious health conditions, including chronic health conditions. They're more likely to experience separations from their families, and they're more likely to experience school mobility and repeat a grade or get expelled, drop out of school, have a lower academic performance. And we also know, according to studies, they're more likely to experience homelessness as adults. So this is where the strategic investment comes in. Again, as we want to solve all of homelessness, we have this opportunity where we can go upstream and solve childhood homelessness. So what we're looking at are strategies that I think you're familiar with. It's called 3 legs of the stool. They're good strategies. They're interventions that work. They include affordable housing, and that's housing where the occupant pays no more than 30% of their income for gross housing costs. Now, we know the challenge there. We know the vacancy rate in Vermont is super low, anywhere from 2.4 to 4.2% vacancy rate. We know that a healthy vacancy rate is 5 to 7%. There is, however, housing when we look at a statewide program for, approximately 450 families. So there is housing available. And again, I think that reinforces the idea that we can focus first on families as a strategic investment. So affordable housing is key. We know there's been investments by the administration and the legislature, much needed, into affordable housing. We do know it will take time to come online, and we know that our housing partners are asking more. We fully endorse that community action. The second strategy, of course, is rapid rehousing with rental subsidies to make housing more affordable. So rapid rehousing is getting a family now that's either, there's 266 families approximately in the state transitional housing or emergency housing program at hotels. We've got a number that are in general assistance hotels in emergency housing. We have a number who are in shelters around the state. And then, of course, we still have families periodically living out of their cars around Vermont as well. So the idea is to get those families and to rapidly rehouse them and move them through interim financial assistance up to 18 months, get them housed, get them stabilized, and then give them the ability to move on towards a more permanent subsidy, federal subsidy. The third piece of this is supportive services. And that's where we need another investment. We know that families, like all of us who've had a family or even individuals, we can have complicated lives. And that rings true for Reach Up folks in Amy's introduction, trying to navigate the many resources needed just to get by in the society today, which is so very tipped heavily towards having a higher income. So targeted support and coordination of services is really, really important. And that means somebody to really focus just on the housing issue and to connect other services that many families often have, but they're often in, they can often be in isolation. We have a very large Head Start program. There's WIC, there's mental health services. I think we can do better in coordinating those services together. So we need more targeted supports for that. So what we're proposing is to include in the budget adjustment additional money for rapid rehousing. So this would be for vouchers. In the BAA, many of you may have seen it. We were surprised because we were advocating for this, and $3 million was put in for rental subsidies for families, which is a great first step. We need an additional 2.1 in that first year to help this work in the Budget Adjustment Act. And then we are also looking at an additional 1.5 million in the Budget Adjustment Act, and then every year after that to put funding in a program that works. And we think family supportive housing is a program that works. It also draws down Medicaid, so you can nearly double your money because you can get that funding out of Medicaid and targeted case management. And that money would go towards homeless coordinators. There would be a better term for that can work with the existing family supportive housing program and with other service providers with their sole goal of really keeping families housed. And then in 2024, we would be asking for another 3.5 million to sustain the rental subsidies, again, to rapidly rehouse and get us up to that 450 people. And this will give some time for more housing families, for more housing to come online. And then we would need around 2 million annually, based on the assumption that 80 families will continue to come into homelessness every year, and they would get those rental subsidies and support services. Again, we are always going to have some kind of homelessness. The point here is to make it rare and as brief as possible. So that's the ask we are making of the legislature for the BAA, and then ongoing funding. When you look at the total amount, it is a drop in the bucket compared to what you get out of this in terms of moving upstream, getting our kids housed. We think it's very important for reach up families and for just basically for our society in general. We also want to get back to the Vermont roadmap to end homelessness. We had a document in 2016 that did a really thorough look at what we need in Vermont, and we want that to be updated. We thought that was an important document. We were doing pretty good back in 2016. We want to reconvene Vermont's Council on Homelessness that came out of the Agency of Human Services. And we want to get the Child Poverty Council back going again. I see that Doug is on this call, so he knows all about that. So anyway, that is the proposal. We think it is doable. Again, we're not going to completely eliminate homelessness, but we will solve it for children by making it as rare and brief as possible with a strategic and what I think is a fairly minimal investment in our children. So that's what I have.
Thank you, Paul. Do you have a couple minutes for questions, or should we?
Sure.
I know
Yeah, I think I gotta go to the BAA testimony in a couple minutes, but I'd love to hear some questions.
I'd love to hear a little bit more about how families manage their budget when they don't have a housing voucher, or how housing sort of funding ties into the reach up picture, if you're able to just share a bit about that.
Well, I think you know, I can't recall what the average family of four in reach up gets for a monthly. Last I remember, it was like $660. I hope that's gone out. The rateable was around 49.5%. I don't know what it is now, quite honestly. But we know that reach up folks, they do have some income towards housing. With the market like it is and the costs like it is, they are going to need rental subsidies to be in housing. And I think rapid rehousing, getting them out of hotels and shelters as quickly as possible is really important for the stability of that family and for the children. And then linking them through long-term federal subsidies is going to be really, really important. But reach up families have the lowest incomes in the state. I don't see how they could. I don't see how they can make it without rental subsidies. I'm not sure if I answered your question, but that's the perspective.
That's really helpful. Thank you. And I see, Christine, you have your hands up, and then there's a question in the chat, but maybe we can save that for the end because I think that's a question that we can, it's not as specific to Paul.
Thanks for the information. Thanks for the invite. Thanks for being here, Paul. I'm just curious about how you are interacting with Susanna's office, racial equity, and I'm also really interested in what kind of accountability and oversight, especially for people that are, really struggling with caseworkers or how their services are being provided. Can you speak about that a little bit? And also just curious about what kind of updated race data you have.
Yeah, I'm with the community. So I'm with Champlain Valley Office of Community Action. I'm not with the state. I just want to make that clear. We're one of 5 community action programs. We're a nonprofit in the state. We are one of the largest. We actually have 2 years ago, we hired a director of racial equity, Virginia Jambu. We do a lot of work for the 4 counties that we cover and for our own organization, which is about 230 employees. We do a lot of work on diversity, equity, and inclusion in the 4 counties, which is Chittenden, Franklin, Grand Isle, and Addison. And Virginia and our organization does connect with Susanna. We also do our own work. We're very involved in our organizational development with diversity, equity, and inclusion. I think we all know that when you've got 1/3 of Vermonters at 185% and below the poverty level, that's a crisis. That is Vermonters who cannot make ends meet. And we all know about the fabrication of the poverty level. So we know within that number, it's going to be disproportionate for people of color and certainly for refugees and new Americans in this country. So we know the impact of the way we structure our economic system in Vermont and in the United States disproportionately impacts folks of color. And that's some of our diversity, equity, inclusion work as well. And it's systems change. Vermont is not immune to it. In fact, it is alive and well here in Vermont. So when we talk about more fair tax policies or raising the earned income tax credit of the state's share, that portion, these things are steps in the right direction for systemic solution. But I don't want to pretend that having a rental subsidy program for people experiencing homelessness is going to solve the deeper economic systemic issues in our country and in Vermont. What it will do is get children housed and hopefully give them some respite, the family some stability to move on in their lives and get other supports. And the way we work at Community Action is it's not just one thing. We have 9 interrelated programs. So we do personal financing. We have a micro business program. We have a tremendous food access program, weatherization, all those intersected things that I think try to help. But even then, I'm super mindful of we could have all the programs in the world, and then if we don't advocate for economic justice and systems change, we're going to be kind of holding back the dam, and that's just a reality.
Thanks for your answer. And I don't want to take up too much time, but I do know that you have an ongoing relationship with Mark Hughes, and that's my husband. I'm the director of the Richard Kemp Center, and Mark has encouraged me to reach out to you and just try to set up a one-on-one so we can talk about how maybe some of what's being offered at CVOEO and other places, we can, talk about how we can partner and do some of that in the Richard Kemp Center. So thank you.
That sounds great. Thank you.
Thank you, Paul. And when we send a follow-up to this session too, we can probably send some information about how folks on the call can support the end child homelessness work as well, because we know that obviously housing is such a big part of meeting basic needs. Thank you. Thank you so much.
Thank you. I'm sorry I can't stay. I would love to hear the rest of it. I look forward to the next meeting, but thank you all for your work.
Great. And now I'm going to pass it over to Dr. Julie Lowell, who is going to speak from Public Assets Institute around the funding matrix that we use to figure out our basic needs stipend.
Great, thanks, Amy. I'm gonna just start with a small caveat of a puppy that just started whining, so I apologize. I'm gonna try to keep him in. Thank you for that introduction and to Voices for coordinating this series. And thanks to all of you for being here today. As Amy said, my name is Julie Lowell. I'm a policy analyst at Public Assets Institute. And for those of you who don't know Public Assets, we're a think tank that improves the well-being of everyone in Vermont. We use research, fiscal analysis, public engagement, and empowerment, and the development and promotion of state policies that government enact to advance racial, social, and economic justice. And Reach Up is a program that has long been on our radar as being out of sync with the needs of families and in the state. So for years, the Reach Up benefits have been a fixed amount, failing Vermont families. And it's just in the last few years that, that those monthly benefits have regained any lost ground. So today I'm going to highlight how the program's failing to support Vermont families who are in need, how benefits have remained flat for years, and how families who receive Reach Up still fall short of their basic needs, even when you consider other benefits. So just give me a minute here and I will share my screen. Make sure I'm sharing the right one. Okay. All right, so on the screen here, you can see that in 2020, not all families who were living in poverty in Vermont, just one measure of those in need, and as Paul mentioned, not always the most accurate measure, but it is a measure that we use. Not all families that lived in poverty received benefits from the Reach Up program. In fact, only 71% of families in poverty received Reach Up in 2020, compared with 80% in 1996. So we're doing a worse job today of supporting families in poverty than we were when the program first started, which is when President Clinton promised to end welfare as we know it. And I think this is not exactly what I would have had in mind if I wanted to end welfare as we knew it back then. So this same analysis that provided the numbers you're seeing on the screen, these aren't available for 2022 yet, but it's likely that Reach Up is actually doing an even worse job today. In November of 2022, Reach Up served 3,677 Vermont families, and that's compared to over 7,000 Vermont families with children who were living in poverty in 2021. So that's a little over half of families in poverty that received Reach Up this past November. So this makes it pretty clear that Reach Up is falling short of its stated mission to improve the well-being of children by providing for their immediate basic needs, including food, housing, and clothing. And so there's a number of elements that contribute to this uptake mismatch, including relatively flat benefits. So you can see in this next chart that benefits remained flat from at least 2004 until they saw an increase in 2019 and 2021, thanks to the hard work of a lot of community advocates that are on this call today. But these benefits are still leaving Vermonters with less than half of a Reach Up determined basic needs line. So that red line that you're seeing on the screen, that's what the Reach Up department, the Department of BCF has determined as what the basic needs line should be for families, and yet they're still just providing them with less than half of that. When you take into account the changing value of the dollar, as you can see in this next chart, the value of Reach Up has actually declined since 2004. So the increases in 2019 and 2021 merely brought the benefit closer, but not up to its 2004 value, which I think is pretty striking. What these low benefits mean is that fewer families are eligible for the program, even as they're struggling financially, and other families choose not to enroll in the program at all because of the low benefits. For families that do receive Reach Up, the benefits they receive continue to leave them short of their basic needs, even when taking into account other benefits they might receive. So the chart on the screen now, it shows the maximum monthly benefit a family of four received in 2021. That's the blue portion of the bar at the bottom of the screen, along with additional benefits they might receive from 3 Squares Vermont or food assistance, LIHEAP or fuel assistance, and Lifeline or phone assistance. But you can see that these benefits fall short of the state determined basic needs estimate. So that's the red line on the screen that the Joint Fiscal Office determines. And they're also falling short of the basic needs budget, which is set by the Reach Up program. That's the blue line on the screen here. And one of the big differences, there's quite a big difference between the Reach Up basic needs estimate and the JFO basic needs estimate. And two of those big differences is that Reach Up has a much lower cost of housing and food than JFO's basic needs estimates. And I would say that these Reach Up estimates in general are much too low. So now is the time, and it really has been the time, to bring some change to this system that's supposed to be providing for Vermont's children's immediate basic needs. The state really needs to create a benefit that keeps up with the current year cost of living every year, not just as they decide there's some extra money in the budget. And they really need to create a benefit that provides families with the appropriate level of support so that they can meet their basic needs. So thank you so much for your time and interest in being here today. I really look forward to being a part of the conversation going forward, and happy to kind of get more into the weeds with any of these charts as people are interested.
Great, thank you. Thank you, Julie. We'll save questions for the end just to make sure we have enough time to get through everybody's presentation. I wanted to shift it a little bit for Paul because I knew he would be leaving the call. But now I'd like to introduce Donna Bailey, who's here to share sort of what all of these numbers mean for children, youth, and families in Vermont.
Hi, thanks for having me. My name is Donna Bailey, and I'm the director of the Addiscon County Parent-Child Center, and I've been director here since 2000 and here a bit before that. And you know, have been working for economic and social justice and equity in most of my life, certainly my adult life. And I appreciate having been a part of last week's conversation and looking at the history and in today. So thank you, and thank you to Voices for doing this. I think the history is important, and the context that we live is important to this conversation, and sort of how Reach Up feels for families who are on it. You know, we live in, I may be stating the obvious, but we live in a country that values wealth. I think more wealth for some, more than basic human needs for everyone. And as long as we are in that situation, of course, we're going to have a conflict. And I think while many of us in Vermont pride ourselves on doing better in that than some places in the rest of this nation, we're still not doing enough to ensure that Vermonters are getting their basic needs met. And I really appreciate Julie Lowell's information right before me, because I think that says it very clearly. Like, we know we aren't giving half, at least, which is already a low number, to families to be able to get by. And I think, you know, I like to say the American dream's a nightmare for people who live in generational poverty, and people feel blamed for being poor. And we know that's not true, but I think we know that a tongue-in-cheek comment of pulling yourself up by the bootstraps made by Ronald Reagan, you know, has been a shift for certainly, you know, many decades, for people to think it's their fault that they're living in poverty. And so I think, you know, while we've done some good work again in thinking about how people can access benefits and to make some changes, and some recent changes, those are good. And when I talk to families, they're like, okay, yeah, but, and the but is about having a system such as Reach Up that perpetuates that feeling of inadequacy and I'm doing something wrong. And even, you know, I think that there are many subtle issues that go on that are hard, you know, and I might go sort of micro into some of those, but also there's the big policy issues that keep, you know, the BIPOC population, women and children poor in this state and nation. And, you know, I think it's an important thing to know too. And, you know, I just Googled it up and looked it up again to make sure before I spoke to you today, but the average stay on welfare, TANF, Reach Up, whatever you want to call it, since it began has not changed. So we can talk a lot about policy, and it's important to do so, but I think the reality is that tells me, at least, that families access support, you know, systems when they have to feed their children, to house their children, to take care of their families. And they don't want to stay on this perpetual myth that exists around, you know, wanting to stay on welfare and milk the system isn't really true, you know. And so I think the average stay is about 2 years. And that, again, that hasn't changed. So that tells me that, you know, a lot about people just needing assistance. You know, I think, you know, when I talk with families, no one wants it, but they will get it to take care of their children. But when people feel bad, you know, about it from the programs they're in, I think then we have work to do as policymakers and as people who are doing the work and helping people to navigate systems. So, you know, I think, you know, it's $600 and something for a single parent and one child. and try to, we all know that it's impossible to live on that. And I think, again, when I talk to families about speaking today, it's a bit harder to think about the big macro systems for people when they're just trying to survive. And so many could talk very specifically about things that have made them feel bad in this system. But the bottom line is every person I talked to and every family member and other agencies said people need more money. And instead of Vermont choosing to put some of TANF dollars into other programs and systems, we need to match that in Vermont and increase the basic benefit for every family. And that is, I hear over and over again. So again, work requirements could change, things like that, but the bottom line is more cash flow. I think transportation is the next thing that comes up for people. People, who don't have cars, can't afford to keep a car, really need support around transportation. I think many people entering the system too have other sort of emotional needs or mental health needs or needs for more education and training, have experienced trauma. I think poverty is trauma. And I think that we need to make sure that we're helping people be in a place where they can be ready for work and to be able to move on in a really productive way. And I think some of the basic issues that come up for people while they're in reach up is sort of hitting this middle class thinking that happens, and I want to just give an example of that, because I think for people, who are trying to help, it's really important for us to understand that sometimes our help isn't helping. And so, I think about the system of phone interviews. Now, and I'm going to disclose that I am a guardian of a child, so I have a Reach Up Child Only grant. So I experienced this, and I have a master's degree, and I, do this work and advocate for people. And still, I get some letters in the mail, and I'm like, whew, that was scary, And I know I can push back. I know it's legalese, but it's scary to get a message saying you're going to be cut off unless you do this, right? And those kinds of things. So the way we communicate is important. The way the state communicates, I think the way that then people have to call for a phone interview. People can go into the office, but many of them don't have a way to get there. And that can happen quicker. But most people do calls. The calls can be 40, 60-minute waits. And if you are living in poverty, you probably don't have a phone plan. You probably are doing minutes for your phone. Not everybody, but many people. And so what happens is all your your phone minutes get eaten up, and you are still waiting in line, and you get cut off and you can't do it. And so people really need help supporting, getting through and navigating those systems. But that's just one example of a sort of rules base where it's missing a basic fact that people don't have all that phone time. I think what we need to do is create rules that are empowering to people, to make sure, like I think historically when Vermont went through the Clinton and then the GW Bush sort of changes and reach up, we spent a lot of time thinking, especially under the Clinton administration, thinking about what we could do proactively to think developmentally about families that were on there. For young parents, we made sure that time limits wouldn't get in the way of completing secondary and some post-secondary education, things like that. And so I think we really need to get back to that place where we can think proactively together. And I think this is one example of doing that. But, I think, and I'm excited about new proposed legislation that would increase the money amounts and to eliminate the rateable deduction. But when years ago, when we were talking about making changes, one of the things that many of us did was help people move to SSDI, to Social Security Disability, because we were afraid of time limits. We were worried that people weren't going to be able to have a monthly income. And now some of those folks who I talked to again are concerned because they don't get all the reach up benefits that exist. So I think we need to think about benefits packages beyond programs, but for people's needs in Vermont. Sorry, I lost my train here. And then, I think the other piece is that we need to make sure that we have community partners, like here, parent-child centers, the community actions, if that people can really help families navigate the state systems, because the state systems are tricky. for people to navigate. And we need to also be sure that we're all thinking together to move forward and to reduce poverty, but also to help people access programs. Families really appreciate benefits and appreciate, the ability to access them. I think, again, people would appreciate more money on a monthly, especially with food costs going up, and transportation is a big need, and housing, of course. The other thing people talked, and again, I work with young families, so people talked about the need for driver's education and for secondary and post-secondary education and training dollars. So that's the other place, and time and childcare to do so. So in Vermont, again, I think we can't think, yay, we're doing a great job here in Vermont. We are doing better than many places, but we have work to do. And I think we need to shift our thinking and cultural norms around poverty. And, I think young families and in our community deserve better in this country. Thanks.
Thank you, Donna.
Mm-hmm.
And last week, Nate Hine brought up a few comments around his experiences and wondering about the administration burden of the program. And so I invited him to come talk a little bit about the experiences he's had working with folks who are Reach Up participants and some of his thoughts. So Nate.
Sure. Yeah, thank you. Thank you for inviting me to talk. I mean, what's different about me from the previous speakers is that I am not a policy expert. I'm a guy with muddy sneakers trudging around, visiting families and talking to people and so forth. I'm a guardian ad litem, so I've been doing that for some years. And I've been also an advocate, volunteer advocate for domestic violence and sexual assault survivors, and of course their families when that comes up. The comment that I made, was about, I use the term administrative burden because it's what I learned recently. But the issue of the sort of the Kafkaesque jungle into which people are thrown when they're trying to actually get the services they need and the support they need. It's really striking how difficult it is to understand, for someone who's just trying to get by. I mean, the number of different programs that you need to somehow understand and write different applications for. I mean, it seems like every program has a different application, and they all have different. I mean, it's a lot of the same information, but you got to put it in a different place. And some of them you got to fax it. Some of them you got to go online. Some you got to walk in person. So, back to even the most basic things, it's pretty common if you've been couch. I mean, I'm surprised and shocked to have found out how many people have told me that I was couch surfing and my things were thrown out. So I no longer have my birth certificate or my children's birth certificates and all the social security cards. And I can't even submit applications for housing without those things. And so now that you're trying to figure out how to engage with the Social Security office and actually get an appointment, and you're on the phone, if you have if you have phone minutes, you're on the phone using those minutes on hold for hours, waiting for an appointment to talk to Social Security, so that when you go in, they can tell you what documents you don't yet have, and you go through that cycle multiple times, right? So, and you can't, until you do that, you can't apply for various other kinds of aid because you don't have documentation that you actually exist. So I mean, we in political discourse, it's common to hear about how red tape gets in the way of economic growth because it impedes the work that that small businesses need to do to expand and get employees, and large businesses spend vast amounts on their legal departments and so forth. But we nevertheless, we seem to have a lot of programs that just give money to people with money so they can spend more of it so they can create jobs, supposedly. But if we give money to people who need the money the most, then we're concerned that we're making them dependent and that they're going to waste it and then they're going to spend it on drugs. And so we set up systems to try to prevent that. And it seems like each program has a new set of systems that's supposed to prevent dependency and, get people back to work as soon as possible. And they're all different. I mean, you could say, all right, well, there's not enough, people can't afford to buy sunscreen. So let's start a national sunscreen program. And it's going to have an application process, and it's going to have a, criteria, and they're going to have to argue with every state as to what their reporting requirements are, and how they're going to assure the feds that yes, it's being spent wisely. And what people with limited means need, what poor people need is more money. And there's quite a bit of basis in through experiments that have been done to say that if you give people money, that they do better. And they're actually pretty good at using that money. The first thing they do, almost always, is to buy the things that they really need. They buy diapers, they buy feminine hygiene products. They get a car. They pay for their minutes. So this school supplies, the things that they otherwise can't. But instead, what we're doing is we're making people memorize this amazing list of. You got a program for fuel assistance, program for food assistance, a program for medical, different, which doesn't cover dental, and it doesn't cover housing. Every all these different bureaucracies, each one of which needs to be treated with utmost respect and care and feeding and so forth. I was in a meeting recently where a young mom was taken to task for misusing the word shelter. She talked about the next thing. It was a GA housing context, right? And I've been in hearings where I had to explain to the lawyer and the judge what I meant by when I said GA housing. There's the alphabet soup. It's it's mind-boggling for anybody, and I can't imagine that doing all this stuff isn't far more expensive than just giving money to people. So I know we can't just go to a UBI tomorrow, but what we could, I think, be talking with the legislature about is something like, there's a common app, right? In when you're applying for college, right? You fill out a common app, and that goes to all, you can use that for all the colleges, right? So you don't have to do things entirely special for each college. Could we have a common app for benefits? Could we, so there's, I think one of the responses that people have had to this problem is that they come up, that we have people who are case managers, and we have people who are navigators, and we have people who are gatekeepers, and just a million terms for people whose job it is to know all this stuff and help families through it. Maybe there's a way to consolidate that, and maybe the way to consolidate that is just have fewer programs. Maybe Reach Up could include some of the things that are currently not part of Reach Up and instead are a separate program. Maybe Medicaid could include dental care, and again, a young mom recently that I was working with who's never had dental care, and her, she's struggling to take care of her child and meet all the other things that she needs to do while her face hurts all the time, and she cannot afford to have have whatever the dental surgery she needs, and it's not covered by Medicaid, and there's nothing she can do about that. No one's going to do this work for her. So she's just always in pain. A single mom, right? Sorry, I am a squeaky wheel. I am whining about things that I can't fix, but I hope people who do have the chance to figure out how to simplify and reduce the extraneous stuff will make a priority of that going forward.
Thank you, Nate. I appreciate you sharing your experiences. And I think, so we have about 10 to 12 minutes left. And I know a question came up earlier about the Poverty Council. We have a few folks on the call who have been a part of the Poverty Council long before, I was connected to it, although Voices was one of the original members. I don't want to put you on the spot, Karen. We can also come back next meeting and share more depth of the history. But the Poverty Council was renamed and changed to the Strengthening Families and the Advisory Council on Child Poverty and Strengthening Families. It has not met in the last year or so. And I think that's one piece of advice that Paul had brought up, that it might be helpful to bring a group of advocates, impacted folks, and legislators together again to really commit to solving child poverty. I think it's something that, the process for that is that you have to have the legislature assign chairs and representatives and then to call a meeting together. But if that's something that folks feel like would be productive, then I think that that's something we could advocate for. It looks like there are a couple. I'm going to end the spotlight. It's hard to navigate that while talking. But there have been a couple of questions in the chat. And so I want to give folks a chance to kind of jump in and either share their experiences or ask questions of the speakers today.
Well, Amy, I mean, since everyone's being so quiet, this is Christine Hughes. I'm the director of the Richard Kemp Center, the old North End of Burlington. There's a couple of you that I'd really like to connect with individually. Thank you, Nate, for what you've presented. I really appreciate it. And I would really like to connect with you maybe through email or something, because not everybody speaks about this stuff the way that you are. And I just really appreciate what you were saying. Thank you.
Thank you, Christine. I'm going to give it a few more minutes because sometimes it takes a little bit for questions to percolate. I know that Doug Racine on the call was one of the original founders of the Child Poverty Council. Again, I'm not going to put folks on the spot to share all of the history today, but I will put it together for the next week's call.
Amy, I don't have a question, but I would love to echo everything that Nate said about our system, which is completely broken. And, the housing issues that Paul talked about earlier are overwhelming. And if we don't have some systemic changes, we can put some Band-Aids on, but there just need to be some real systemic changes. I've talked with you about this family that I'm working with, and DCF basically ruined their lives by plunging them into poverty when their child who was on SSI went into custody, and they lost the SSI, became homeless, and so on and so forth. So that's really what I wanted to add to the conversation. I'm working with a family who is a train wreck, and we need some serious systemic changes to make anything happen, and take away the shame and blame that goes with it. And one thing that often comes to my mind is guaranteed income. I think Richard Nixon actually proposed that back in the 70s, guaranteed income for all, do away with all the programs, which that wouldn't really work. But anyway, that's I just wanted to add that to the conversation. Thank you.
Thank you, Rachel. And I did see a question in the chat around getting more involved. So this is week 2 of a 3-week learning series. And next week, we're going to spend most of our time talking about the Reach Out Coalition and some of the work that's been done thus far, but then also the exciting new legislation that's being proposed for the upcoming year and opportunities to, one, get more cash in the hands of families, but then also to talk about sort of the structures around how we determine what a basic needs budget looks like, how housing is linked into the picture, and sort of to get a commitment to working together on these pieces. We have just a couple more minutes, and I see in the chat that Karen Lafayette is willing to give just a little bit more information about the Poverty Council. So I'm going to turn it over to you, Karen.
Hi, how are you all? Good to see you. I guess, I think Doug is on, but he doesn't want to chime in. The Poverty Council, I'm not going to recall the years, but was created some time ago, I think 2009. And it was for the purpose of reducing child poverty by a certain percentage. And we were quite active. It was made up of legislators from the House and Senate, from and administrators, and a number of advocates from low income and child organizations, that type of thing throughout the state. We did a different types of work, and we worked with the council, state legislators, and we did some research. We produced a number of reports, and we didn't have a lot of. It was staffed with some legislative folks, but it never had a lot of funding to go further than that. But it was well attended, and there was some really good information produced. We supported legislation, or we supported budget items, or that type of thing. And then there was a lull of a few years where there was a kind of a changeover, and we didn't meet, and we reconstituted it with a subsequent legislature. And I think we changed the name to Child Poverty Council Strengthening Families. There is a report that exists each year of things that we put forward and or supported. And I'm sure we could come up with something more substantial if people wanted to look at that. But the last couple years, I think we were able to meet, but sometime in and around COVID, when we stopped, we basically suspended meetings. And although it's still listed on the website as a committee, a committee created by the legislature, we have not met for a couple of years. I actually had a question into the new chair of appropriations, Diane Lanford, because she actually chaired it in one of the previous years, to see what we might be doing with that. And I'll be in contact with the speaker too, but it'd be great if people want to, I don't know, see if it's worthwhile kind of revising that or doing something with it, along with the Regional Coalition. And a lot of the faces and the people have changed in terms of legislators and or advocates that were previously on it. So we certainly could look into it.
Thank you, Karen. I just want to end with more gratitude for Paul and Julie and Donna and Nate and all of you who have done so much to build energy around reinvesting in children, youth, and families. And so we have one more lunch learning series in this Reach Up segment. And our hope is to really spend next week talking about Reach Up and what is possible going forward. So we hope that you can join us for that. We hope that you can connect to voices and hear and engage in the work going forward. As I said, when we send a follow-up to this communication, we'll share some opportunities to engage and join the Reach Up Coalition, but also just to contact your legislators and be present in the work going forward. So thank you so much for your time today and for your expertise. And I hope to see as many of you as possible again next week.
Thank you.
Thank you.